Women's awareness of heart disease has increased. Women tend to present later, and they present in different ways. Would a woman be more sensitive at detecting that in another woman? Maybe. I think most women would argue yes. You know, it's very interesting. In cardiology, even though the percentage of women professionals in neurosurgery and other surgical specialties has dramatically increased, in cardiology it's like around 20%. And some people think that that's part of the reason that women's cardiovascular care is not fully realized. In other words, if you look at almost every clinical trial, women only represent 25-30% of the population, yet they're enrolled in the trial or that they've tested the new therapy on when they're 50% of the population or more. So why is that? Well, just anecdotally, I can tell you that women do tend to underplay their symptoms, that they tend to be caregivers. That's well documented. So, women's awareness of heart disease has increased. Women tend to present later, and they present in different ways. Would a woman be more sensitive at detecting that in another woman? Maybe. We've done some studies with implanted devices to try to figure out if the women who implant them are more likely to implant more women than not. We haven't found that. We haven't found that if you go, that women implant more women. Now, maybe that's because they're not referred those women in the first place. I don't know. But it's interesting to me that in specialties where women get to choose, in other words, patients, they'll always choose another woman. If you look at OBGYN or pediatrics, women generally will choose same-sex providers.